Our second letter here is from Kim. She says, I was given a diagnosis, doesn't feel right. My symptoms don't adapt and what my doctor told me. I'm really clueless and want to know why because it doesn't make sense. So
sure, that's a great question. I want to say, Kim, I know healthcare is very tricky, but there are many reasons why that may have happened, and I can give you a couple of reasons why. The demands of today's fast-paced healthcare environment leaves little time for healthcare providers to really spend hours of investigating patients' unique issues and case to figure out the best outcome. The system just isn't, unfortunately, built like that anymore. And in the end, the patient truly suffers because they're not really getting the proper diagnosis and care that they need to many times. Office visits are often crunched into like 15 minutes or fewer time frames. Patients are squeezed last minute into appointments because things are short-staffed or there's an overflux of patients. And so there's this multifactorial issue. And again, it's just not the most ideal situation to help when you have an undiagnosed issue. So even when healthcare providers really want to dedicate that extra time, their schedule and date and job doesn't often allow for that. The healthcare logistics make it nearly impossible, to be honest. And this issue is often the reason why misdiagnosis occurs. There are so many ways to solve that issue, Kim, and I don't want you to feel alone or terrified because we definitely can help you through your journey.